Hello, this is Dr. Mehtab, second year resident of Community Medicine Department from R&T Medical College, Udaipur. In the previous video, we have discussed about the barrier methods and intrauterine devices. In this video, we will discuss about the hormonal contraceptive of a family planning method. Hormonal contraceptives are divided into oral pills and depot formulations. Oral pills include combined pills, progesterone only pill, postcoital pill, once a month pill, male pill, and depot formulations include injectables, subcutaneous implants, and vaginal rings. Oral pill make first combined pills. It is given orally for 21 days, beginning on the fifth day of menstrual cycle, followed by a break of 7 days. Withdrawal bleeding occurs in those 7 days. Ministry of Health and Family Welfare made available two types of low dose oral pills, Mala N and Mala D. We can see the images of Mala N and Mala D in this slide. Mala N is supplied free of cost. It contains 0.15 milligrams of levonorgestrel plus 0.03 milligrams of ethinyl estradiol. Mala D is supplied for sold for 3 rupees per packet. It contains 21 oral contraceptive pills and 760 milligrams of ferrous fumarate tablets. Then progesterone only pill. It is also called as mini pill or micro pill. It contains norethistyrone and levonorgestrel. It is given for older women with cardiovascular risk and younger women with risk of neoplasia. Then postcoital pill, also called as morning after contraception, used as an emergency method after unprotected intercourse, sexual assault, contraceptive failure. It is recommended within 72 hours of unprotected intercourse. Two methods are available. One is IUD and other is pills. IUD should be inserted within 5 days after unprotected intercourse, and especially copper devices are used for this. Then hormonal methods. And different regimens are available. One tablet of 0.75 mg levonorgestrel within 72 hours should be given. Then second tablet should be repeated after 12 hours of the first dose. In other method, two pills of 50 micrograms of ethinyl estradiol should be given within 72 hours, and the same dose is repeated after 12 hours. In other regimen, four pills of 30 to 35 micrograms of ethinyl estradiol is given within 72 hours. Then same dose, four pills are repeated after 12 hours. Another regimen include mifepristone 10 milligram once within 72 hours. So these are the images of levonorgestrel and mifepristone. Then once a month pill, long acting estrogen is given in combination with short acting progesterone. Has high pregnancy rate, causes irregular bleeding. Male pill prevents spermatogenesis. Interfering with the sperm storage and maturation. It prevents sperm transport in the vas, affect the constituents of the seminal fluid. They lower the testosterone level too, affecting potency and libido. Gossipol, trade name Gossipol, derivative of cottonseed oil, effective in producing agiospermia or oligospermia. It may cause permanent agiospermia in 10% of men after 6 months of usage. In mode of action, for combined pill, it blocks the pituitary secretion of gonadotropins and prevent the release of ovum from the ovary. Mode of action of progesterone only pill, it renders the cervical mucus thick and scanty, inhibits sperm penetration, inhibits tubal motility, and delay the transport of sperm and ova into the uterine cavity. Effectiveness of these contraceptive pills, combined type, are almost 100% effective in preventing pregnancy. Effectiveness and continuation rates are lower for progesterone only pill. Effectiveness can be affected by drugs like rifampicin, phenobarbital, and ampicillin. Adverse effects include cardiovascular effects like 40% high death rate seen in women who use IUD compared to those who do not use them. Cause of mortality is myocardial infarction, cerebral thrombosis, venous thrombosis with or without pulmonary embolism. Risk increases with age and cigarette smoking. Next adverse effect is carcinogenesis, increased risk of cervical cancer with increased duration of use of oral contraceptive is seen in some of the case control studies. Then metabolic effects, it includes elevation of blood pressure, alteration of serum lipids, decrease in high density lipoproteins, elevation of blood glucose and plasma insulin. It affects blood clotting, may accelerate atherogenosis, resulting in MI and stroke. Other adverse effects include liver disorders like hepatocellular adenoma, gallbladder disease, cholestatic jaundice. And lactation, high amount of estrogen adversely affects quantity and constituents of the breast milk, less frequently cause premature cessation of lactation. Then subsequent fertility causes, these OCPs cause slight delay in conception. 15 to 35% of the women become pregnant within 2 months of discontinuing the pill. Then fetal development, increased incidence of birth defects of the fetus is seen in the women using oral contraceptive pills. Then common unwanted effect of these OCPs include breast tenderness, breast engorgement due to progesterone, pain and tenderness occurs due to estrogen. Weight gain is seen in 25% of the users, managed by salt restriction in the diet. Then headache and migraine. These OCPs may aggravate migraine. Patients requiring treatment of migraine with ergotamine should avoid OCPs. Then bleeding disturbances. Breakthrough bleeding or spotting in early cycles is seen in some. Withdrawal bleeding may be absent in some. Then beneficial effects of using OCPs. They provide protection against at least 6 diseases. Benign breast disorders like fibrocystic breast disease and fibroadenoma, ovarian cyst, iron deficiency anemia, pelvic inflammatory disease, ectopic pregnancy, ovarian cancer. Contraindications. Absolute contraindications of OCPs include breast cancer, cancer of genitals, liver disease, cardiac abnormalities, congenital hyperlipidemia, abnormal uterine bleeding. These OCPs should be given under medical surveillance in people with women of age more than 40 years, then smoking and age more than 35 years, in mild hypertension cases, chronic renal disease, epilepsy, migraine, lactating mother in first 6 months, diabetes mellitus, bladder disease, history of infrequent bleeding, and amenorrhea. Medical supervision and duration of use. For women more than 40 years of age, alternate contraceptives should be advised instead of OCPs. Women taking OCPs should be advised annual medical examinations. Before prescribing OCPs, examination to be carried out to identify those with contraindications, those with special problems that require medical intervention or supervision. Then depot formulations. It include injectable contraceptives, subdermal implants, and vaginal rings. Injectable contraceptives include progesterone and combined injectable contraceptives. Progesterone only injectables include DMPA, which is depot medroxyprogesterone acetate, NETEN, norethistyrone enantate, then DMPA SC. Then DMPA. Intramuscular injection of 150 milligrams of DMPA given every 3 months. Mechanism of action. It acts by suppressing ovulation. It has indirect effect on endometrium and direct action on fallopian tubes and cervical mucus production. It doesn't affect lactation. Adverse effects include weight gain, irregular menstrual bleeding, and prolonged infertility after use. So this is DMPA, medroxyprogesterone injection. It is manufactured under the trade name Antara, NETEN. Intramuscular injection of 200 milligrams given, norethistyrone enantate given every 60 days. Both DMPA and NETEN given as deep intramuscular injections in the gluteal region. This is the site. Then both are given in first 5 days of menstrual period. The mechanism of action is inhibition of ovulation, progesterogenic effects on cervical mucus. This is norethistyrone. Then DMPA SC 104 milligram. Depot subcu provera 104 injected in the skin rather than muscles. So the previous two injections were given deep intramuscular injections in the gluteal region. Now this injection is given in the skin. So given at an interval of 3 months, can be given in upper thigh or abdomen subcutaneously. Patterns of bleeding changes and amount of weight gain are similar to intramuscular injections. This is the image of DMPA SC104. Then adverse effects. Causes disruption of normal menstrual cycle, episodes of unpredictable bleeding, sometimes amenorrhea. After discontinuation of DMPA, women become pregnant within 5.5 months. At 2 years, more than 90% of the users become pregnant. Then combined injectable contraceptives. It contain both estrogen and progesterone. Failure rate of includes cyclopharma, cycloprovera 0.2% and Mesigna 0.4%. Mechanism of action of combined injectable contraceptives is acts by suppressing ovulation, progesterone effect on cervical mucus, prevents sperm motility, render uterus unfavorable for implantation. These are the images cyclophem or cycloprovera and Mesigna. Contraindications of these contraceptives include cancer of the breast and genitals, undiagnosed abnormal uterine bleeding, suspected malignancy, thromboembolic disorders, patient with history of stroke or CAD, patient with diabetes with vascular complications, or patient with focal migraine, lactating mother up to 6 months postpartum. Then subdermal implants. Norplant contains 6 Cialis capsules of 35 milligrams each of levonorgestrel. Norplant 2 in fabrication of levonorgestrel into 2 small rods. Norplant contains 6 capsules. Here Norplant 2 contains 2 small rods. Capsules or rods are implanted beneath the skin of the forearm or the upper arm. Effective contraception is provided for 5 years. Disadvantages include irregular menstrual bleeding and requirement of surgical procedures for insertion and removal. These are the images of Norplant and Norplant 2 R. Then vaginal rings. Vaginal rings contain levonorgestrel in low doses. Ring is worn in vagina for 3 weeks of the cycle. It is removed in the 4th week of the cycle. It bypasses metabolism by gut and liver. In the next video, we will discuss about the post-conceptional methods.